Hi, I'm Dr. Kristen Plunkett, and I want to talk to you today about blood draws. Some of my patients have a lot of difficulty with getting their blood drawn, and I want to give you some tips for success to make yours as easy as possible. The first is hydration. You need to be hydrated before you come in for the blood draw. If you have not been drinking enough water for the week prior, it's just not going to be enough to get those blood vessels nice and big for us to access them. You want to be drinking at least 64 ounces per day for at least a week before you come in. The other thing that helps with the blood vessels being really large is exercise. The more that you exercise regularly, even better. But definitely the week prior to the blood test, make sure you're getting at least 30 minutes per day of exercise. Hydration, exercise are really important, but so is temperature. When it's really cold out, your blood vessels are going to constrict and it's going to make them really small and hard to access. So make sure that you are wearing enough warm clothes, maybe even consider putting on a hot pack before you come in order to just make sure that the blood vessel is nice and dilated. Stress is another one that will cause the constriction of the blood vessels, so really working on deep breathing exercises, or consider doing something like Rescue Remedy, a couple drops before the blood draw, just to keep the stress response a little bit lower so those blood vessels do not get so constricted. When you're coming in for fasting blood tests, that's going to be for your thyroid, fasting blood sugar, or cortisol. You want to make sure that you've been fasting for 12 hours prior to the blood test. So if your blood test is at 8 a.m., you don't want to eat anything after 8 p.m. Again, still drink water. Fluids are perfectly fine, but nothing with any calories before the blood test. They also need to be done before 9 a.m. if you're going to be doing the cortisol. If you're getting your thyroid checked and you're on thyroid hormone, you want to get the blood test fasting before you've taken your thyroid dose, or at least 4 hours after you have taken your thyroid. Otherwise, the labs are not going to be accurate. If you're on hormones, you want to make sure you're not doing any of your hormones the morning of the blood test. If you're on injectable hormones such as testosterone, you really want the blood test right before you're due for your next testosterone injection so we can see what the blood levels are at your very lowest. We really hope that you have the best successful blood draw at your next visit.